Anorexia nervosa is a medical term that signifies a loss of appetite. A person with anorexia nervosa, however, may not have any loss of appetite and often is preoccupied with food and eating. A person with this disorder may suppress the desire for food in order to control his or her eating.
Alright, yeah, no, that's cool. I'll meet up with you guys later. I'm just going to work out really quick and then I'll take a shower and head out.
During this video, you can see that Heath has been running for a very long time. He is not satisfied with his calorie loss, and he is not willing to get off the treadmill to meet with his friends until his personal goal has been met.
As you saw in the previous video, Heath was experiencing social withdrawal and exercising excessively. These are two of the many behavioral symptoms of anorexia nervosa. In this next video, you will see Katrina demonstrating denial of hunger, lying about amount of food eaten, social withdrawal, and fitting in exercise during down periods.
Hey, are you guys hungry?
Yeah. I already ate. I had a really big breakfast.
Okay. Well,
I'll go get food.
You want to go get something?
Sure.
Okay.
Well, I'll catch up with you guys later since I already ate. So I'll just meet you there.
Okay. That sounds
Okay.
like you need to
Okay. Yeah, I'll
Okay.
call you when I'm on my way because I'm just gonna do some homework and maybe take a nap or something.
Okay. Okay.
See you in a little bit.
See ya.
Yeah. See you guys.
The following videos illustrate two of the many red flags for anorexia nervosa. The first video shows Catherine eating a meal with an eating ritual, such as cutting food into tiny pieces. The second video shows Sarah looking through the refrigerator and picking a safe food that is low in calories.
Calories. 110. calories. 10 calories.
Some of the red flags of anorexia nervosa include frequent checking in the mirror for perceived flaws and complaining of being fat. In the following video, Katrina demonstrates these behaviors.
So fat. Need to do more lunges. I'm not going to eat today.
Some of the risk factors for anorexia nervosa include being female, a young age, genetics, family history, weight changes, transitions, sports, work, and artistic activities, and the influence of media and society. You will now see a family therapy session where a member of the family is suffering from anorexia nervosa.
Is a 22-year-old female with a history of anorexia nervosa. She was admitted to the hospital at 5'3", weighing 72 pounds. She has a history of working out excessively and counting calories. She limits herself to 200 calories a day. She has been at Alexian Brothers Behavioral Hospital for 1 week. This is her first family therapy session.
Carly, why do you think you're here?
I don't know. Everyone thinks I have a problem, but I don't think I do. I like the way I look.
What do you like about the way you look?
I think I look beautiful. I'm skinny and I don't have any fat on my body, and everyone likes me better because I'm so skinny.
Okay, well now I want to open it up to your family and have them express their feelings toward your actions.
Carly, I'm just so worried about you and what could happen to you. I don't want you to turn out like Mary-Kate Olsen and have that, lifelong body image problem. You're my baby. I would be miserable if you were not here anymore. I'm just so worried. I just can't watch you kill yourself from this disease. You have to get better. Please, please do it for us. We can't see you like this anymore. You have to get better, and we care about you so much.
We see you are very upset. Here are some tissues. Let's get someone else's opinion. Mr. Jepson, would you like to share?
I just don't understand why this started. Was it something I did or Mom and I did to make you feel this way? Did we just put too much pressure on you with grades or sports? That wasn't our intention at all. We just wanted you to succeed. I can't help but feel like I'm the one to blame for this. Or could I have done something to prevent this from getting so out of control? You were always my little girl. I just wanted you to protect you, but clearly I failed.
No, Dad. I'll always be your little girl. This isn't your fault. It's not your fault.
Carly, I'm so sorry if we did this to you.
Carly, how do you feel about this? I bet it is hard to hear and see how upset your parents are.
I guess I just never thought it was affecting them. I just wanted to look good. I don't understand why they're blaming themselves. This is my body and I can do whatever I want with it.
Of course, you would only think of yourself. When are you gonna see this isn't just about you? Can't you see what you did to Mom and Dad's relationship? They're blaming themselves for your problem.
Justine, I see that you are very frustrated. Let's focus on that frustration. Why are you having these feelings?
I just don't get it. I try to be the best role model for you and guide you in the right direction. I just don't understand. You were always good in sports, you were on the honor roll, your life was perfect. What happened? Why did you start doing this? Or you're throwing it all away?
Carly, how do you feel about your family's reaction?
I just feel like everyone's attacking me. I want to be like this. Why can't you just let me live my life? I'm 22. I'm going to do what I want to do.
We're not attacking you, honey. We are doing this because we love you and we care about you and we just want you to get better.
Nothing's wrong with me.
Are you kidding me? You're 72 pounds. You can see all your bones.
Let's all just step back a second. Clearly everyone is upset. Carly, can you at least accept that you have an eating disorder?
Well, I think they think I have an eating disorder, but it's not as big of a deal as they're making it out to be.
Are you willing to begin treatment for your own sake or for their sake?
I mean, I guess I'll do it for their sake.
So what would be the next step for her to recover?
Well, we just need to start her with group and individual therapy sessions. That way she can express herself, not just to her therapist, but to girls that can relate to her eating disorder.
Can't you just have her, eat more meals or put her on a eating schedule of some sort?
Well, that is one of the parts, but for her to have a full recovery, she needs all the aspects of the treatment in order to succeed. Anorexia nervosa is not just a physical action of simply restricting. There is also a mental component that causes them to restrict their diet. We want her to get better, not just physically, but emotionally and psychologically as well. The nurse will talk later with Carly about her nutritional needs and goals that should be met at this point. If you need anything,
After family therapy, the next step of the treatment process is patient education. The goals for anorexia nervosa nutrition are metabolic recovery, weight restoration, reversal of medical complications, improved psychological functioning, and improvement in eating behaviors. Now you will see the RN-patient relationship in an anorexia nervosa.
Hi, Carly. I'm
Hi.
a nurse here on the floor. My name's Catherine.
It's nice to meet you.
I'm just going to talk to you a little bit about nutrition today. Is that all right?
Sure.
Okay. So when you think of fat, what do you think?
My body's fat. I don't want fat. I try to avoid it in my food, on my body, everywhere.
So more or less, you think that fat is obviously a bad thing.
Yeah, it's scary.
Well, I just want to come and teach you a little bit about how fats are actually not a bad thing and that we actually need them in our diet. Is that all right if we talk about them for a bit?
Sure.
Okay, so there are two types of fats. There are good fats and there's bad fats.
Okay.
So there's monounsaturated fatty acids and polyunsaturated fatty acids, and both of them are considered good fats.
Okay.
So in general, a good rule of thumb is usually they're like liquid at room temperature. And so MUFAs, the monounsaturated fats, some good.
Like olive oil.
Yep.
Okay.
Yep. So then it would be olive oil, canola oil. Avocados are really good, or walnuts. Do you like avocados?
Yeah, but I only like to have a little bit because
Okay.
they're so fatty.
Okay, but actually they're really good because they end up lowering your cholesterol, which is a good thing because you understand cholesterol.
Yeah.
Just okay. So obviously it can increase your risk if you have high cholesterol in your body. So.
Okay.
That's good. And then you have the polyunsaturated fatty acids, which are also good cholesterol, or fatty acids are good because they lower your cholesterol also.
Oh.
And so examples of that would be like corn oil, safflower oil, canola oil, sesame oil, fish, and margarine.
Okay.
And then they can actually be further broken down into, have you ever heard of essential fatty acids?
Yeah, kind of.
Okay, so you have two essential fatty acids, and the reason why they're essential is because you can't produce them yourself. So you need to get them from your diet. And so your body doesn't work correctly, and the cells in your body need the fat in order to form their outside membrane. And so you need omega-3 and omega-6, which are two essential fatty acids.
And that's like fish.
Yep. So omega-3 is the fish, and they are considered fatty fishes. So you have the tuna, salmon, mackerel, sardines, rainbow trout, anything that's a little bit fattier in fish.
I don't mind tuna.
You don't like tuna?
No, I don't mind it.
Okay. Tuna would be a really good thing. I mean,
Okay.
usually like 2 times a week is usually a good thing. And then omega-6 is the other type of essential fatty acid, and you can find that in like vegetable oil and salad dressing. So that's a really easy way, and like usually people have that as a good source.
Okay.
So, just to review, those are the good fats, so the MUFAs and the PUFAs.
MUFA and PUFA are good.
Yep.
Okay.
Yep. Okay, so then we're going to talk a little bit about the bad fat, which is the actual fat that you should avoid. So,
Okay.
you have saturated fat and trans fat, and both of them are going to raise your cholesterol in your body, which is obviously a bad thing because it's going to increase your risk of atherosclerosis, heart disease, and everything that comes with that. So, a good rule of thumb is that saturated fats are usually harder at room temperature. So you kind of think of like animal fats. So, like meat, shortening, butterfat, eggs, dairy products, and then palm and coconut oil if you cook with either of those. Okay. And then you have your trans fat, which are, they were like manufactured differently. And then usually like the reason why they use them is to make food taste better. But the problem is
it's like McDonald's.
Yeah.
Ugh.
Yep, exactly. So more or less the trans fat, what they're doing is they're trying to change the way it tastes. Okay. So pretty much all processed food, so anything that's fast food, a lot of fried foods, more or less like commercially bought foods, so cookies, crackers, that sort of thing.
Okay.
And something that you should be aware of is that on food labels a lot of times they put partially hydrogenated oils, and that is a red flag to you that that's actually trans fat.
Okay.
So in general, you want to avoid saturated and trans fat because they're not good for you.
But MUFAs and PUFAs, fish, nuts, and olive oil type stuff.
Yep.
Good
Yep.
fats. Okay.
Yep. Avocados if you like
That
them.
makes sense.
Tuna like you were saying. So, mainly the big thing is that we don't want you to be afraid of the word fat because fat is actually a good thing for you to have in your body.
Yeah, it makes a lot of sense. But there are bad fats.
There are bad fats. Yes, there are bad fats, but as long as you look at the nutrition label and you're okay with MUFAs and PUFAs, but try and avoid those trans fat and saturated fats.
Sounds good. And then I'll just get like a pamphlet or something for
Yep.
to help
Yep,
me
I
out.
have one for you. Just 1 second.
Okay.
There you go.
Thank you.
Perfect. Have a good day.
You too.
Metabolic recovery. During anorexia nervosa, metabolic rates drop by 50 to 70%. During nutritional rehabilitation, caloric needs expand dramatically. Calories need to exceed baseline during recovery and can then return to baseline after stabilization. Caloric intake of up to 3,400 calories required for weight gain of 1 pound. Weight restoration. Weight gain changes are based on inpatient or outpatient. If inpatient program is sought, 2 to 3 pounds per week are required. Partial hospitalization is 1 to 2 pounds per week. If you're an outpatient, it's a half a pound to 1 pound per week and 130% of predicted energy expenditure. They predict a gradual increase over 24 to 48 hours.
Reversal of complications, electrolyte disturbances. Hypokalemia and hyponatremia are the most common. Hypokalemia will cause vomiting, abusing diuretics or laxatives. Hyponatremia with excessive water intake. Vital sign instability. Bradycardia and orthostatic blood pressure changes. Signs will resolve when 80% of expected weight is recovered. Resolution of complications can be illustrated by the following: cardiovascular abnormalities, exercise capacity decreased, left ventricular and cardiac output are preserved, resumption of menses, weight at 90% of expected weight, brain changes, cerebral spinal fluid spaces increase while gray and white matter decrease. Ventricular and white matter recovery are possible with nutrition rehab, but gray matter often does not recover. Reversal of complications. Reduced bone mass occurs in 90% of young anorexics. Multifactorial from poor nutrition, too much exercise, estrogen deficiency, and low weight. Osteopenia sometimes not totally reversible with refeeding. Hip density often remains lower than expected after recovery.
During anorexia nervosa, psychological function is affected. Reaction times and free recall deteriorate, but with rehabilitation, cognitive function and mood improve. Attention, depression, and cognition improve with rehabilitation. Improvement in eating. Food hoarding and other behaviors lessen with rehabilitation. Obsessions about food decrease with rehab, and preoccupation with food and the distorted body image are the last signs to disappear and can fail in some cases.